Good afternoon, everyone. It's a pleasure to be here. Gweru is my hometown. I was bred and battered in Gweru. So I am a product of the old Central Zimbabwe Conference. When I'm here, I'm back at home. Currently, I'm in worshiping in West Zimbabwe Conference, the new one, not the old one. But I'm happy to be back home. And also I'm delighted to be part of this convention, the first of its kind. I want to congratulate the Zimbabwe Central Union Conference for having such a gathering. When I was talking to people, it seems people are coming from all over, Masvingo, Triangle. It's quite a blessing to be part of such a gathering. May you continue to have such gatherings. And also the quality of presentations I was enjoying myself since in the morning. Please continue having such gatherings as a union and maybe as conferences. I also want to thank the organizers for giving me this opportunity to talk about men's health. So I'm just going to do that, men's health. You know, in this segment, if you are seated to your father-in-law or mother-in-law, maybe it's time to move. Because we are going to talk about the hidden organs, aren't we? We are not going to be, we are going to talk about it as it is, aren't we? Even in sign language, I hope they are going to, there's no one interpreting here. I was interested to know how they translate some of these things. So men's health, you know, men's issues, you know, a lot of people advocate for women, but men's issues are not advocated for most of the time, and men are quiet. So I'm very passionate advocating for women, for men's health. It may be NGOs or government policies, they are biased towards women and children's issues. Even in church, there's no men's ministries, do you know that? But we've got women's ministries. So issues that affect men are neglected. And men, they seem not to have a voice. But I'm going to be that voice today and advocate for men. If you look at this XY, this is the genetic makeup that makes us men who we are. Especially this Y. This one is the one, if it becomes present in a fertilized egg, that baby is going to become a man. Andy, I'm just going to elaborate what I'm saying, because we need to understand where we come from as men. We are made in a special way by God. So this is our outline of what we are going to talk about. I just want to go quickly, maybe in the next 30 minutes, then I leave the rest for questions and where you need clarification. This is going to be a fast presentation. So this is what we are going to go through. So this is what, so the genetic makeup, every person has got a pair of 23 chromosomes, a normal person. So these are like the software. If you look at this computer, it has got a software which drives how it functions. So as human beings, we are fearfully and wonderfully made. We've got this software. So these are the genes that program how we function as human beings. These are the genes that determine whether you're going to become light-skinned, the position of hair. They send messages. So as men, we start here. So this is a male child, genetic makeup of a man. So this is the X chromosome and the Y chromosome. If it's a female, it's XX. So what I want to highlight on this is this one comes from, all the time, it comes from the father. The sperm that comes with an Y chromosome, the child becomes a male. So if the father is always sending sperms with eggs, they are having daughters, aren't they? In our culture, if a woman is giving birth to daughters only, the blame is on the woman, aren't it? Today I want to teach you what's correct. It's always the father who is giving the wrong sperm. Oh, all right. It's not wrong anyway. It's God who is blessing you with daughters, aren't it? So let's not blame our daughters-in-law. Let's not blame our wives and marry another one. It is God's plan that we have daughters. And anyway, it's you who is sending the sperm with an X chromosome. So it's your responsibility. The children, the sex is determined by the sperms that come from the father. The woman faithfully gives a sperm that has got an X chromosome all the time. Then the sex comes from the father. So I want to deal with the politics with the mothers-in-law and daughters-in-law. And this Y chromosome is the one that sends, there's got what's called a sex-determining region on the Y chromosome. So it's the one that will now trigger the formation of the release of male hormones and also formation of male organs that will differentiate us from the females. So once you have this, you have a male. What I want to also highlight is, if you have, let's say we take away all the men in this world, the women that will remain will never, if you do cloning, you will never be able to make a man from women. But you can make a woman from a man by cloning. This is confirming the Genesis story of creation. That you can, from Adam, you got Eve. So women on your own, you cannot create a man from you. We don't. All right. So if you want to, you can use genetics to confirm the creation story. Genetics confirms what the Bible is saying, that women came from us as men, aren't they? So this is my bone, the bone of my bone. She was taken from me. But not me from her. That will never happen. Yeah. So this is where we come from as men. So this is, after ovulation, is just the, and you see how tiny we were and delicate. And God took us through this process. This is the male child being born. Until you can see something like a, so this is the first 3 months, which is delicate, where organs are being formed, and you have a baby after 3 months. Then after 3 months, the baby starts growing. But this is a delicate period where if the mother takes all those poisonous things, some malformations can occur at this stage. So the first 3 months, very critical. Let's teach our young ladies at church, wherever we are, let's teach them to be careful, to watch what they are eating when they are pregnant. And most of the time, you don't actually know you are pregnant this time. And injuries will be happening. So what Dr. Dondo said about us watching what we eat, let's remember, it's coming again. It's going to come anyway. So there are 3 basic principles I want to teach men. And even the ladies that are here, I'm happy you are here because you contribute to some of the things that affect us as men. So the first one, the basic principles for men who are here, and as you are going to go back to your stations, you should continue to teach this. The first one is a healthy diet. So for you to function as a man properly, you need to eat a healthy diet, a balanced diet. I will not go into detail about these things, fast foods that are now coming. Let me just elaborate how they affect us as men, these fast foods. We want to indicate left, and most of the time. These ones, we don't no longer want to eat them. Let me show you how they affect us as men. So obesity, it has been talked about. But let me just clarify how it affects us as men. If you are obese, BMI more than 30 kgs per square meter. But of course, if you are above 25, still you've got a lot of fat in your body. What it does, if you have a lot of fat in your body, there's a hormone that is called testosterone that makes us who we are as men. That gives us the libido or the drive to want a woman, and also that determines our features. You see, where we have beard as men, it's that hormone that determines that. Some have got umpavanga. It's because of that hormone. It has got a lot of effects. Our shoulders are broad, our muscles. So it's that hormone that does that. But if you are obese, that hormone is going to be converted in the periphery, like in the fat. It's going to be converted by an estrus that is in the fat to a female hormone. So, these days I see a lot of young men that come and they are struggling in the bedroom, in the most holy place. They are not doing the normal services. At 30, already someone is struggling. And if you look at their habits, their diet is very poor. And this is what's happening in the body. The testosterone is converted into the female hormones. And now they cannot perform as men should perform. So let's be very careful. And also other issues that have been already elaborated also come into play: hypertension, the chronic diseases, diabetes, which affect us, how we function as men. If you have a weak heart, there's no way you can perform all the duties of a man up to standard, like working hard for the family, and also in the most holy place. Your heart will give up, and you have heard of men who have collapsed during the act. So as men, you need to have a strong heart and a strong body. So diet is very important. So let's avoid diets that have got a lot of calories, a lot of fats, refined diet. I think you know the standard diets that I'm talking about. So remember the male hormone converted to female in the fat. So if you have a lot of umkaba, the pot belly, we know it's a sign of wealth, but it can be a sign of other problems in the... Yeah. The second principle is regular exercise. It's very important. I'm going to come from another angle. I know it has been talked about by Dr. Dond. Let me just come in the angle of how it affects men. Regular exercise, it is known by studies that after exercise, the testosterone levels increases after exercise. We need this hormone as men. Even pastors, you need this hormone. Yeah, they agree. Yeah, you need this. Otherwise, things will not be well at home. So see how much exercise impacts the levels of testosterone in the body. So regular exercise is important, even for sexual function, it's important. I know if I talk about sexual function, you are going to follow it. But if I talk about hypertension, you may not be interested. The second basic principle is adequate rest, adequate rest. As men, I know our economy is difficult. We want to work for our families, to chase the US dollar. Sometimes we may spend a lot of hours working and we are not resting. It's not good for you as a man. You need to rest. And also women who are here, make sure your husbands they get adequate time to rest. Sometimes they work hard for you, then when they get home, you are also harassing them and they can't rest even in their homes. So they need to rest and to give them time to rest. I know I'm not going to talk about Sabbath, but let me just show you how rest affects us men. Right, this is from the National Sleep Foundation. People who study sleep, and yeah, in some centers there's actually a sleep room where people they'll study your sleep cycles. It's only that in our hospitals we are not that advanced, but this is a serious issue, the issue of sleep, and it affects. If we are not careful, we may not be getting enough, or maybe we are sleeping too much, aren't we? So as for children, of course, newborn babies need a lot of sleep because they are still growing, and us as adults who are here, it's recommended we sleep 7 to 9 hours. So minimum, some say minimum of 6 hours per day. And this should be continuous sleep and not interrupted. Let me show you how it affects us as men. So we've got what's called a sleep cycle. When we sleep, there are 5 cycles that we go through. The first stage is when you are a bit conscious. So if I get into the room, you quickly wake up, aren't you? Yeah. Then as we go up to stage 5, you get into deep sleep. At stage 5, this is where you get into the room, we lift you, we put you aside and take the bed that and you will not hear what has been happening. This is called rapid eye movement. At this point, the eye is moving very fast, and you'll be in deep sleep. So if you want to know, to search for the money that has been hidden by your husband or your wife, just to check the eyes. If they are rapidly moving, you know, this is the time to... You can always... So this is called rapid eye movement. What's important is, if you are... So you need about 90 minutes for you to get to this stage, this one, from stage 1. And you move from one stage to another. But you need more of these ones, stage 5. So if you are sleeping for 1 hour and wake up, you may not reach to this stage. And at this stage, this is where testosterone is released into the system. So you need about 6 hours uninterrupted sleep, for you to have multiple or to have a bit lengthy period at this stage. But if you are having interrupted sleep, you will not have much of the rapid eye movement stage. And you will not have the benefit of testosterone. Let me show you what happens when you are sleeping. So we know that testosterone increases during sleep. If you have quality sleep, this is for someone with quality sleep. You see the graph is up. Someone with a poor quality of sleep, the graph is a bit low. So I know men who are here know that when we wake up, sometimes around 4 or 5, we have early morning erections, aren't we? This is because of this testosterone. This is the physiology behind that. There's nothing special about it. It's because of the testosterone that has increased. If you have been asked to do this test, when you go to the lab, I know lab scientists that are here agree with me. This test is only done in the morning, actually around 10 a.m. They will never do it. A proper lab will never do this test in the afternoon, because we know that the levels go down during the day, and it goes up as we go to sleep. So women who are here, don't deny your husbands early morning sex, because the testosterone is very high. It's physiological, and allow them the privilege to have early morning sex before they go to work, because the testosterone will be very high. So adequate sleep is very important. So I'm just going now to, I've finished the 3 basic principles that affect men, which is a balanced diet, regular exercise, and adequate rest. I'm just going to go to the particular conditions that affect men. I'll start with the conditions that affect children. And children are also men or males. So there's this condition which is called undescended testes. This is when the testis is not in the dependent part of the scrotum. The scrotum, you know, the scrotum is that sac that carries the testes. I'm looking at the sign language. It's interesting. Yeah. So the testes are supposed to be in that dependent portion. The scrotum, they are not supposed to be resident inside there. If the testis is not there by the age of 6 months, then we say that's an undescended testis. And we know by the age of 1 year, if we take 100 boys, 1 of them will have undescended testes. It's a fairly common problem that affects boys. And it's unfortunate that the fathers that are here, they are the weakest link to pick this problem. It's mostly picked by the mothers or the grandmothers especially. The grandmothers are the best people to pick this problem. I don't know how they do it. But fathers are totally out. I don't know why we are not there. When my son was born, I think that was the first thing I searched for. I searched for them, and I will not tell you what I found. So this is what would have happened. You know, in the Bible they say you came from the loins, and the children come from the loins. The loins is somewhere here. The testes from development, they come from this position. They come from here, they descend. Right? They come from here, for those at the back, from here, then they descend down. So there's a journey which is called the transabdominal descent, then transinguinal descent until it reaches here. So if it's not there, it's an undescended testis. If it's caught up somewhere here, why should it be in the correct position? This sac works as a thermoregulator. It's like an air con for the testicles. You know, when it's very cold, it shrinks and brings the testes closer to the body. When it's hot, you know what happens. So to control, so the temperature in this, it's below the body temperature. And it's the perfect temperature for spermatogenesis or development of sperms. So if the testis is caught up here, the body temperature is quite higher, and that testis is going to suffer and it's going to become smaller and smaller. It's worse when both of them are not there, are up here. And that's when you have your daughter-in-law is not getting pregnant after a good wedding. But it's because of you have missed it. You missed it when you could examine your child. So the reason why we need to bring it down is because of the temperature. It's worse when it's both sides. So I want to encourage fathers who are here, please examine your sons. As soon as they are born, they will not, if they are still babies, they will not refuse. But you cannot go now to a 13-year-old and say, I want to examine you. Yeah, they will be surprised. What has gotten into you? So let's examine what is they are still young, aren't. The proper thing is, all these babies, I know there are healthcare workers here who are running clinics, and this thing is supposed to be picked at birth by the midwife who is receiving the child. They should pick it, or if it's missed, it should be picked on the successive visits, like the 6 weeks. It's unfortunate in our setting, I think we are missing it somewhere. We are not doing our duty as healthcare professionals. Let's examine these testicles, aren't they? I think there are routine things that we do. So if you are running a clinic, an Adventist clinic, which delivers mothers, please you have a protocol where you check standard things, and this is one of them. And please hunt for them. If you have doubt, you need to refer the child to maybe a pediatrician to confirm whether they are there. I will not go into detail about the other things that can happen, like the structural testes, but undescended test is very common, and it's a problem. If it's missed, this should be corrected before 2 years. It's unfortunate we see kids now, 15-year-olds, 20-year-olds, who come and they want to be corrected. It will be too late. That testicle, they've suffered from the effect of temperature. So please, let's pick it early and let's have it corrected on time. So it's corrected by surgery. So I've done justice to that. I will go to the, this is the effect of temperature. Look at this. This is a normal testicle. Look how big it is. And this is the one that is in the abnormal position. The size of the testicle will tell you how much of sperms that are in that testicle. So if it's very small, it means nothing much is in that testicle. So just to compare our souls, if you are in the wrong place, you die spiritually, and we need to continue to be in the arms of Jesus. Otherwise, we continue to die spiritually, like that testicle. There's what's called, the next item I want to talk about is what's called communicating hydrocele. So this is where there will be a communication between this cavity, where the bowels are, and the scrotum. And there will be a fine, small communication, which brings fluid to this place. The testis is normal, but there's fluid that is surrounding this testicle. So it's called a hydrocele. But in kids, it's called communicating hydrocele. It's a common problem. So if you see a child who has got swelling that is on and off of the scrotum, this is the most likely cause. Of course, you may have a hernia where the bowels are now coming in. It's almost like the same problem. But this is not as urgent as the first one that I have presented. So this one just needs an operation to close this communication. So we should be able to pick it from our clinics and even from home. Let's avoid communication with evil. So the next thing I'm going to talk about is these two conditions, phimosis and paraphimosis. So in an uncircumcised penis, it looks like this one. So there's a foreskin, like a cap, that covers the penis, the head of the penis. So it's like a shower cap to the penis. So it's supposed to open, and we see this head of the penis. But this may be too tight, this opening, which is called the propitial opening. It will be too narrow that compared to the head of the penis, such that you cannot retract the foreskin over the head of the penis. That's called phimosis. So it can be physiological, like young, when our young boys, they will have this, most of them, but we expect it to resolve after a few months. But let's not forcefully open it, aren't it? If you want, you can. If you are worried about it, you can just take your child for circumcision. But it's not. The only problem that it may give is if there are collections here, you can have recurrent urinary tract infections. So if you see a young boy who has a phimosis, having temperatures and always scratching their organ, it's most likely that they are having maybe infections. They can have a collection of sebum here which can become infected, or they can have a urinary tract infection. So that may be an indication for circumcision. So any temperature or discomfort down there, or a child is crying when they are passing urine, there may be an infection down But otherwise, we expect it by the age of 6 years to have opened on its own. Then the paraphimosis now looks like this one. So this is when someone forcefully opens this, and this part comes behind the head of the penis. So it becomes trapped behind here. So this may close the circulation to the head, but rarely does it cause necrosis, but it may cause necrosis. So this is a fairly urgent condition. So let's not, you can reduce it if they come early, it can be reduced at a healthcare facility. I just wanted to talk about this condition in adults. If you see a narrowed foreskin, which is cracked, think about diabetes and maybe HIV. So when you are doing your examination and see cracked foreskin, please do a random blood sugar check and HIV. Most of the time, it's a red flag for those two, immunosuppression. Then I'm now going to teenagers. From the age of maybe 12. Of course, this condition happens in neonates, but I'm just going to focus on the teenagers. When a young man or young boy presents with acute scrotal pain, what's classical is it's sudden onset pain in the scrotum. And please, nurses who are here, who are running clinics, don't make a diagnosis of STI. This is not an STI, auntie. There's what's called testicular torsion. It's a very common problem in teenagers, maybe up to the age of 25, but you can see it even above that. I've seen a 33-year-old with this. So what is testicular torsion? So this is when the testes, so remember I said the testes come from the loins. So there's a cord that comes from up there which brings blood to the testes, and nerves come to the testes. So if there's a twist on this cord, and it blocks the blood supply to these testes, if there's no blood supply to an organ, that organ is going to die. So it's an emergency. This is an emergency. You need to treat it as an emergency. Otherwise, if it's not untwisted in the next 4 to 6 hours, this testis is going to die. We remove a lot of these testes. They come and they're already black. Healthcare workers who are here, there are 3 levels of delay. The first level of delay is the patient themselves. They will have this pain and they are quiet. They are shy to communicate it to anyone. I think this has to do with our relationship as parents to our children. They are so shy to communicate to us what's happening to them. They may tell a friend, but they will not tell their father. So I want to appeal to fathers who are here. If you have a son, you should be the first person to know about this or anything that is happening to your son. Try to have a closer relationship to your son. Because this is a matter of time. If it's not treated within 6 hours, we are going to remove these testes. So the child should report to someone. Then action is taken. Then normally they are taken to maybe to a clinic or to the family doctor. So there can be a delay there also. So to healthcare workers who are here, please don't delay patients who come with this problem. Or don't give them 1 gram this side, 1 gram. You know that for STI, Angie, this is not, if it's acute, so you should take you a good history. Once it's acute onset pain in the scrotum, what's classical? It's not that dull pain that has been there for the past 2 months. It's usually they know when it started. They actually can tell you it started at 12 o'clock, midnight. They can tell you, they can pinpoint when it started. And if it's early, there will not be any swelling. I know we want to first find a swelling there will not be any swelling. But once there is swelling, it's becoming late, and chances of saving that testicle will be quite low. So acute onset pain in the scrotum is an emergency. So let's have a system, referral systems to the next level where they can deal with this problem. There are also delays where people or doctors want to do an ultrasound scan to confirm. You know our system is slow. If you send someone for ultrasound scan, they are going to be there for the next 6 hours. And we are going to lose that testis. So I want to beg my colleagues that are here, if an investigation is going to delay therapy, please don't order it. It's better to open and find it's not a torsion than to confirm on ultrasound scan, then lose the testis anyway. Yeah. So if you have I think you should be polite to the healthcare workers if you think they have missed this, and tell them, don't you think it's this problem? Sometimes they would have missed it, but it's quite common, I tell you. So Lucy refers to our hospital. So the nurses who work in Solus Clinic, they are so vigilant with this problem. So we have saved a couple of this. They've picked them, quickly referred them, and we have saved quite a number. So what I've noticed, if there's someone on the ground who knows this problem, you save quite a number of them. But if on the ground people don't know what's happening, you lose quite a lot. So this is a condition when I'm called even at 1 a.m. and I'm told the patient started to have scrotal pain 2 hours from now. I will quickly wake up, rush to the hospital without even thinking. And I will push everyone to get into theatre. Then we will apologize after untwisting the testes. I think we should be very aggressive. I know when there's a ectopic pregnancy, and that's the other emergency in females, everyone will rush. I know why people rush when there's an ectopic pregnancy. A maternal death, you report it, and you report it, it goes to the head office. But these ones, it just ends there. What is, the testis has been lost, then what? But it's a big problem. It's a big, and some that are missed, you may have an unfortunate person where they have a torsion. What happens with time is the pain will start to subside. If no treatment is offered, the pain will go away, but the testis is going to die. It will just become smaller and smaller and vanish. And the torsion can happen to the other side. I've seen one boy who had the torsion on both sides, and psychologically is affected by it. He is no longer able to have children. So we should be vigilant. So if we delay, we lose the testis, aren't we? So let me give you an example of how it looks when the testis is dead. It looks as black as this one, aren't it? So there will not be any connection with the body, so the body dies. So that's what happens if any organs lose connection with the source of life, which is the blood. It also happens to us spiritually. If we are not connected to heaven, we will just die a spiritual death. You may be alive walking, but you will be dead spiritually. So let's remember this condition also applies in our spiritual lives. Then I'm now moving to the middle-aged. This is where I also fall. There's an issue of circumcision for prevention of HIV. I know this has been happening for a long. There's a lot of discussion and controversy, and people base circumcising people on the statistics that are of low HIV rates in places where circumcision is done, maybe as a religion, or maybe I just want us to be very clear that circumcision is not a substitute for faithfulness, isn't it? You can still get HIV even after circumcision. If you are circumcised, yeah, it's okay to be circumcised. But let's not teach people that it's a license for you to be promiscuous. You can still get a lot of infections. And the one that I just want to highlight is the genital warts. It's coming up now. I've seen young college going, in Bulawayo there are a lot of colleges. I've been seeing a lot of young men with this problem, genital warts. And they tell you that I've got three, four sexual, it's so bad. Our young people are having sex outside marriage and unprotected sex on top of it. I don't know what we should do to, and this is a problem. And its recurrence rate is high. It's difficult to treat. You excise them, they come back, and sometimes you end up having an option to just chop off the penis because it will be coming. They are so difficult and they are highly transmittable compared to HIV. It's easy to transmit these warts than HIV. Highly infective, and it's now coming up. It's on the rise. Those who work in primary health care facilities, they can testify to this. It's a common problem, difficult to treat. So these things are coming back again. Of course, our fathers probably, if you get an STI, you can brag about it. But now it's not the time to do that. And let's go and teach our young girls and our young men that these things exist and they should be careful, especially when they go to colleges. And also partially treated STIs can cause this problem, which is called a urethral stricture, which is narrowing of the pipe that carries urine from the bladder outside. So you see this part is not normal. So this person will come difficulties in passing urine. And normally it's a young man who is having difficulties in passing urine. So it's also a difficult condition to treat. It needs a reconstructive surgery, which is quite serious. So STIs are on the rise, and it's a major challenge in our setting. Penile cancer, it's also something that I see on a weekly basis. There are some studies which say circumcision protects, especially if it's done when you are still young. It's protective. They actually say it's not known to have someone with penile cancer who has been circumcised as a child. I don't know whether we should adopt it, but the choice is yours. Or maybe you have to choose for your children. But I think this is the major problem, the virus, HPV virus that causes warts. So this is a pre-malignant condition which causes penile cancer. So if you have, the virus that causes cervical cancer also causes penile cancer. So you see the relationship. Yeah, so there's no substitute to faithfulness. We need to teach our friends, our colleagues at our churches, institutions. Let's promote. I know what's coming now is what they call sex education, where they want to promote, where they put condoms in and you know what they are doing in the other nations. But let's teach the first principle, where they have to take care of themselves and wait until they are married. So these things are happening in the middle-aged group, where most of us who are here, the young, fall into. So as we grow older, now I'm going to the adults, to the elderly, where the prostate now comes into play. This is a big problem. So aging, when you are aging, so you have problems with this gland. So you see, this is the bladder, and there's a pipe that carries urine out, which is called the urethra, and it goes through the prostate gland. So as we grow older, this gland also increases in size. So it's part of aging. So as it grows older, bigger, it may obstruct this path. So this is a normal prostate. This is an enlarged prostate. So sometimes, in some men, we don't know yet why some men will go to 90 and they're still passing urine normal. And someone 55, they're already struggling passing urine. Probably it has to do with lifestyle. So this is what would happen. So this enlargement is part of aging. We cannot really do much about it, but we have to be very careful about the symptoms. So you can have a big prostate and it's asymptomatic. The colleagues, my health professionals that are here, if you send someone for a scan and the scan shows that the prostate is enlarged, if they are passing urine well, there's no reason to cause alarm to them, and tell them that your prostate is very big. If you are 60, 70, definitely your prostate is enlarged. But if it's not blocking the channel, there's no reason for treatment or for us to do anything. I'm sure you get what I'm saying. But these are the signs that maybe there's something happening, the symptoms. So the first three are called storage symptoms, where you cannot store urine in the blood. So let me start with frequency. So in this meeting, you can't be here for the whole hour. You already want to go and pass urine. It's called frequency. You're always going to pass urine. Of course, there are other things that can cause it, like if you are poorly controlled diabetes. But you're always going to the toilet. And if it's happening at night, it's called nocturia. So if you are pressed, you can't wait. You have to rush. It's called urgency. So these are called storage symptoms. Then the other ones are called voiding symptoms. So you go to the toilet, there's a desire to pass urine. There's a delay in the desire and the actual passage. So there's a small delay. You are at the toilet, you are waiting, nothing comes out maybe for the next 10 seconds. Then it's called hesitance. Then when it comes, there's a poor stream, it's just going through, you know what I'm talking about. It's not so young men or young boys, it goes up, and when you are getting older, it starts going, until it's now hitting your shoes. So when sometimes it cuts and intermittence and there's dribbling, then after a passage of urine, you feel there's incomplete, you still have urine inside. So these are the symptoms that you may tell that there's a problem, and you need to see your family doctor, or then they will assess whether you need to be referred. Normally what this problem does, it affects the quality of life. It keeps you maybe to the toilet. Remember, you're in a meeting and you're always going out. So it affects quality of life, quality of sleep. So we only treat when there is an impact on quality of life, so that we improve the quality of life. So if you don't seek attention and this problem continues developing inside your body, and there's obstruction here, so the urine will be coming out from the kidneys, but it's not going out. You may get what's called acute renal retention, where it's very painful and urine is not coming out. If you have seen a patient with acute retention, I think that's one of the severe pains that we can suffer as human beings, maybe after pregnancy and stones. You see an old man sweating, and they can't sit down. You tell them, sit here. I know the nurses will say, sit here. They want to command them. Want to take your BP. What they want is just relief, not the BP. And it's unfortunate you want to follow the routine. Sometimes when I see such a patient, I'll cut all the corners and put the catheter, then allow them. Nurses who are here, please don't tell someone in retention to sit down. Make sure the retention is relieved. Then you can do your BPs and temperatures. Otherwise, it's cruel to take your temperature when someone is in pain. You can have kidney injuries. So it's like a blocked sewage. The kidneys are at the end. I think Dr. Dondo talked about the impact of dialysis. You end up needing dialysis. Then bleeding can occur. You can have other complications like bleeding. So if you have these complications, an indication for operation. So this is the benign or the non-cancerous enlargement that I'm talking about. So I'm going to talk about prostate cancer. This is my last talk. Prostate cancer, it's a common problem that we see. There's a cancer registry of 2015. It said about 90% of all the cancers, the new cancers that we saw, they were prostate cancer. But this is cervical cancer. And for the ladies, I'm sure someone has talked to you about cervical cancer. So second to cervical cancer is prostate cancer. And mortality, about 11% of people who died from cancers, it was prostate cancer. Let me show you. So the most common cancers in men. So you see how this graph, prostate cancer is leading. 21% of all the cancers in men is prostate cancer. So this is a common condition. So when you are talking about cancer, cancer is a condition whereby the cells of the body are now abnormally behaving. They are no longer controllable. They grow. They've lost control, Andy. So there's been talk about lifestyle, high-fat diet related to prostate cancer, smoking, and also regular sex being protective. There are some studies that have been out. Like if you are having about 21 ejaculations per month, they say it's protective. But no, these are low-quality research. But what we know is age is a risk factor. Being black, risk factor. If you have a family history of prostate cancer, you need to be checked. So I'm just going to highlight screening. Screening, so what we advocate for is screening. We screen people between the age of 55 and 69. But if you have a family history of prostate cancer, you need to be screened early, maybe from 45. So the screening process involves DRE, doing a digital rectal examination, where we put a finger like this one and feel the prostate. And we do a blood test, which is called PSA. If we suspect, we discuss with the patient and proceed to do a biopsy, which will confirm if there's cancer or not. So this is the people who are supposed to be screened. It doesn't, for doctors that are here, please let's not order a PSA in someone who is maybe 30, 35, 40. It's not that useful. It's recommended to screen patients, if it's for screening, patients between the age of 55 and 69. It has been shown that they benefit from the screening. But if you suspect that the patient, even if they are 70 or 80, and you suspect that there is prostate cancer, there is wisdom in ordering a PSA because you want to confirm whether they've got a. So I'm not talking, this is above 69, it's not screening. You want to confirm whether when you are suspecting prostate cancer. and you need to talk to your patient. They shouldn't be surprised after you just order silently a PSA, then it comes, it's 50. Then that's when you want to talk to the patient now. Because that, it will be now difficult to get them along when you have a high PSA. So you need to talk to them before you do the test and tell them the implications of a high PSA or a normal PSA before you order it. So I talked about prostatic enlargement, which is part of aging. It doesn't require treatment if it's not impacting on the quality of life. Then prostate cancer is a causing lead of death, cancer death in men. We need to screen. So this screening can be, it's changing. These are guidelines that we are using from America. We don't have our own local guidelines. So I will leave this time to a few questions or comments. I've talked about men's health in a nutshell. Let's go and protect the testicles, and let's go and we have functional men who are sexually active. Let's not have young men who are already weak in the bedroom at 30. So there's a hand at the back. I don't know whether they can get a mic.
What is the function of the prostate gland?
Right, there's a question here, what's the function of the prostate gland? So the prostate gland produces about 20% of the semen, auntie. What comes out during ejaculation is not sperms only, auntie. That fluid is called semen, and it contains sperms, it contains some chemicals that will nourish the sperms as they are going to meet the ovum, auntie. So those are the chemicals that they come from the seminal vesicles mainly and the prostate gland. So it's important for reproduction. And usually prostatic diseases come way after we have already completed our families. So after the age of 60, most men don't really need the prostate. They would have completed their families. Of course, some old men don't want to retire. But it's not fair to be having children at the age of 60. Those children will not have a father to play with. But well, there was a end.
Okay, my question is that does andropause have something to do with age or lifestyle? Andropause.
Sorry?
Does andropause have something to do with age or lifestyle?
Andropause, all right. Yeah, it's also part of aging. This is where, so the serum testosterone will drop. It drops with age, auntie. We know it goes down with age. Like I was saying here, that even sexual function, we know. I skipped that topic, it was there, but I removed the slides. We know that as we grow older, even our sexual function will be going down. If you have it once a month, you should praise God. But if you are still young, yeah, minimum 3 times a day. 3 times a week, sorry. We're expecting, for a normal couple, auntie, 3 times it's okay. But it's called a tri-weekly, auntie, 3 times a week. When you are getting older, you try weekly, it means once a week. If you are old, you try weekly as in the body is weak. So you are trying, but it's weekly. So if you are still young, that's the time to enjoy sex, auntie. The days are coming when the testosterone is going to come down and you will not be as active as you. Yeah, so if you are delaying to marry and you are 50, it's urgent, auntie. Please, get married. All right, I'm told there's 5 minutes. Maybe I'll allow 2 hands. Oh, time up. All right, time up. Thank you very much. Please, let's take care of the men at home, at school, at our clinics. Let's put resources on men and save the testicles.